Super online ಇದಕ್ಕೆ ಆಮೇಲೆ ನಾನು ಗಿವ್ ಇಟ್ ಅದು ಆನ್ಲೈನ್ಗೆ 2 years ಆಮೇಲೆ ಕೊಡ್ತೀನಿ whenever we are each one of us
Begin. May we have all those who are standing outside come in, please.
whenever we are talking in the stage that is this over is ಕೊಡ್ತೀನಿ ಅಂತ celebrating this live stream online people and the space will over
Namaskar, namaskara, and a warm welcome to everyone present here. Some journeys begin with curiosity, some begin with learning, and some begin with discomfort, with pain. Today's evening is about one such journey. Good evening, my name is Seema Karant, and it feels especially meaningful for me to be here, not just as an anchor, but as someone who has been a part of Yogavijnana since its inception. Over the years, I've seen so many people walk into this yoga space with one simple intention: to feel better. But somewhere along the way, that journey becomes deeper, from fixing the body to understanding it. And today we are here to celebrate a book that emerges from that very exploration. To begin this evening in the right spirit, let us invoke clarity, awareness, and inner stillness. We now move to the beautiful tradition symbolizing the beginning of knowledge, the lighting of the lamp. May I invite Sri Uttam Kumar, who will start the program by offering the invocation. I also invite our esteemed guests to kindly come forward for the Deepa Prajwalana as we listen to the invocation. May I invite Dr. John Ebnezar, Dr. Lata Satish, and Yogācārya Vinay Siddaiah to kindly join us for lighting the lamp and join us on stage.
वक्रतुंड महाकाय कोटि सूर्य समप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा शारदा शारदाम्भोज वदना वदनाम्भुजे सर्वदा सर्वदास्माकं सन्निधिं क्रियात् ईश्वरो गुरुरात्मेति मूर्तिभेदविभागिनि व्योमवद्व्याप्तदेहाय दक्षिणामूर्तये नमः। शुभं करोति कल्याणम् आरोग्यं धनसम्पदा शत्रुबुद्धिविनाशाय दीपज्योति नमोऽस्तुते। Om Shanti Shanti Shanti.
Thank you, Uttam, for that invocation. Thank you, ladies and gentlemen. Pain is something most of us are familiar with, something that often leads us going in search of a balm or a pain relief tablet even. But understanding pain is a very different journey. The book we are launching today, Understanding Back and Neck Pain, a Yogic Perspective, What Doctors Don't Have Time to Explain, is not just about pain. It's about questioning, it's about observing and seeing the body in a new light. As someone who has seen Vinay teach, I can say this: he does not have quick answers. He makes you observe, he makes you experience, And sometimes he makes you question what you thought you already knew. And this book reflects that very approach. And now we come to that moment we've all been waiting for. May I invite our esteemed guest to kindly join us for the unveiling of the book. Every field, yes. Vinay, we'll continue. Every field sees pain differently. And today we are fortunate to have experts who bring their own perspectives. We are truly honored to have amongst us Dr. John Ebnezar, an internationally renowned orthopedic surgeon and a pioneer in the field of spine health and rehabilitation. He is a recipient of the Padma Shri Award 2016 and has been honored with the Dr. B.C. Roy National Award, highest medical award in India. Dr. Ebnezar is not only a clinician, but also a prolific author, having written over 200 books in orthopedics with international reach. He has contributed extensively to research and education with 70 plus scientific publications and has been a faculty at over 300 international and national conferences. He's also a TED speaker, a motivational speaker, reaching audiences beyond the medical field. He has also received Karnataka's prestigious Rajyotsava Award and Kempe Gowda Award, recognizing his significant contribution to healthcare. He's a holder of 8 Guinness World Records and a recipient of over 300 international, national, and state awards. He's also the founder president of the Geriatric Orthopedic Society of India, GOAI, contributing significantly to advancing orthopedic care, especially for the aging population. What makes his work especially unique is his ability to integrate orthopedics with a more holistic understanding of healing, bringing depth to both practice and perspective. It is truly a privilege to have him with us this evening. May I now request Dr. John Ebnezar to share his thoughts.
Thank you, madam, for that elaborate introduction of mine, which made me more humble and embarrassed, actually. Anyway, thank you very much. ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡಬೇಕು, ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ ಮಾತಾಡಬೇಕು, ಎರಡು ಮಿಕ್ಸ್ ಮಾಡಬೇಕು.
Some people don't understand Kannada. They're only
Okay, right. So it's a mixed audience. So first, let me congratulate our Yogācārya Vinay Siddaiah for bringing out a book, Understanding Back and Neck Pain. A very interesting title, Understanding Back and Neck Pain, Yogic Perspective. So, very interesting title and a very interesting book. So, congratulations. I know the pain of book writing, how difficult it is to write book, not easy, and it is sometimes a very frustrating experience because you are sitting alone in front of the system and writing the manuscript and preparing the proof, all that proofreading. so much of effort goes into book writing. So I should congratulate you. You're a professional, you're an IIT guy, you're a MTech guy. From there, taking a detour, coming to yogic, practice is something very inspirational. So ultimately, I think you are making us realize that life is totally different from the academic excellence, what we achieve, what we target, all of us. So I don't know how he got my contact. So he sent me a message. He said I should come and launch the book and all. I was wondering how he came to know about me. He should only answer that. I don't know. But he came, he sent me a message. The common connect between him and me is Dr. H.R. Nagendraji. I'm a student of Dr. H.R. Nagendraji. I did my PhD there with him. And together we did some 6 original researches in yoga. Yoga as an add-on for backache, neck pain, osteoporosis. And then we had a unique experience of trying yoga on trauma. So nobody tries yoga on fractures or spinal cord injuries. So I think I was the first orthopedic surgeon who ventured into trying yoga, and we showed through yogic practices like pranic energization technique and mind sound resonance technique. The fracture unites early, the callus forms early. So it is a regenerative, role of yoga. Yoga is multidimensional. You all know, everybody is well versed with yoga. It's a multidimensional, and it's having emotional, spiritual, physical, mental components, and it has also got the regenerative role. Now I think everybody is aware there is this entity called regenerative orthopedics, molecular orthopedics, where we use stem cell therapies, we use growth factors, we use ozone, PRPs, platelet-rich plasma. You might have heard or might have undergone the procedures also. So they are known to cause regeneration in the body. For example, osteoarthritis of the knees, where the cartilage is degenerated because of old age. What we do is we use the regenerative substances or the particles or agents like stem cells and other things to regenerate the whole thing. But not many people know that yoga also has got that regenerative capacity. Very few know that. Yoga actually is having a better role than all these agents what we are using, because it is sustained practices regenerate all the degenerated tissues. So that we proved in the osteoarthritis of the knees research. We proved that when yoga practices are added into modern orthopedic practice, then it completes the treatment lacuna. Modern medicine, we are known to replace the knees. We are known to do a lot of physiotherapy, exercise therapy. But diseases are multidimensional. So when we combined yoga and we did the research, we could show that the arthritis, deformities get corrected, pain get relieved, and osteoarthritis happens in old age. In old age, there are multiple comorbidities like diabetes, hypertension, IHD, asthma, overweight, all this. So yoga helps in addressing all the issues. It is like buy one, get 4 free offer. You buy one, you get 4 free. That means you do one yoga practice and you give multi-dimension, physical, mental, emotional, spiritual. So we proved with research. And this research was published in peer-reviewed indexed journals, and American Academy of Orthopedic Surgery, who framed the guidelines for the management of nearly 100 orthopedic conditions. They framed the guidelines which are followed in 185 countries across the world. So they picked up the research what we did in Yasvasa. My 4 papers they picked up. And they framed the guideline for OA knees, that is osteoarthritis of the knees, non-arthroplasty management, means non-knee replacement management. And they gave the recommendation strong. What is the strong recommendation by AAOS, that is American Academy of Orthopedic Surgery? If AAOS recommends something as strong, then it has to be practiced universally without even asking any questions. That's what it says. They have got strong recommendation, moderate, then low, and then indeterminate. So there are 4 recommendations what they give. Our research work got the strong recommendation, and there are 16 modalities of treatment for ONEs other than surgery. In that, 11 are conservative management, that is non-operative management, and 5 are operative management, different surgeries like arthroscopy, osteotomies, all that, other than knee replacement. So this is called non-arthroplasty management of ONEs. So yes, as a work, what we did got us into the top bracket. And out of that 16, there are only 2 strong recommendations. Only 2 strong recommendations for this 16. One is our work, then second was the NSAID. Earlier it was paracetamol, then now it is NSAID. Out of 16 modalities. So that means the research what was done has to be now followed without questions. Usually what happens nowadays, when a patient comes to us for treatment, they have got 101 doubts in their head, right? They go for first opinion, second opinion, third opinion, Google opinion, ChatGPT opinion, this opinion, that opinion, so many opinions, right? And more than clarity, they are confused, right? So, but when AOS recommends the treatment, you don't have to answer anybody anything. You have to just recommend the treatment, they have to do it. So that was the work what we did through this, IAYT practices, integrated approach of yoga therapy. Simple, nothing to be complicated. Along with modern treatment like medicines, physiotherapy, we inculcate the yogic practices called integrated approach of yoga therapy, and that gives excellent results in patients because it addresses the patient as a human being. We are not targeting the disease. We are not targeting the person. We are not targeting the joint problem. We are targeting the entire person. So that is called holistic treatment. It is not HOLI. It is WHOLI, whole body. So WHO definition, World Health Organization defines health as a complete state of physical, mental, social, and spiritual well-being is health. It is not just physical health, right? So that is the concept of holistic orthopedics, and that is how I came across holistic principles, and I coined the term holistic orthopedics. And now holistic orthopedics is like an umbrella treatment. Everything under the treatment armamentarium comes under holistic, whether it is surgery, whether it is regenerative molecule therapies, or it is physiotherapy, exercise therapy, whatever it is. Everything is under the umbrella of holistic orthopedics. Now, significant progress has been made. Lot of workshops, CMEs conducted across the country and the world also. I've given nearly 40 global orations. Went to USA, Atlanta, New Switzerland, Thailand, and then Germany, and propagated holistic orthopedics. So they are more receptive than our country. The outside nations, they receive us more than our own people. So the holistic orthopedics is now a recommended form of treatment for almost everything in orthopedics, whether it's back pain, neck pain, or whether it is osteoporosis, osteoarthritis, and now even in fractures, uniting the fractures early. So that is the holistic concept, and that is how the whole thing has been popularized. And we did a research with this mind sound resonance technique that is called advanced yogic practices. You all know yoga. You might have seen in the TVs, and you come and do some practices here. Yoga is not just about asanas. There is much more to yoga. Yoga is a huge science. There are a lot of advanced yoga techniques like pranic energization technique, where you use the outside prana, you imbibe it into your body, into your body through a technique called absorption. You assimilate the energy, the solar energy, the light energy, you assimilate, you push it inside your body and direct it towards the pathology or towards the diseased organs. Say, like, for example, diabetes. So pancreas is the culprit here. So we direct the cosmic energy towards the pancreas, and imagine that light is healing the pancreas. It is like that laser therapy. It is acting thus on the pancreas. So this stimulates healing. This stimulates the parasympathetic activity. And the person starts feeling better. So this is the advanced yogic practices. Maybe you may come across in future. My wife is sitting here. She is also a MSc Yoga and she is an Ayurvedic surgeon. With her, we did the research, mind sound resonance technique for neck pain. Published papers, excellent results. So what mind sound resonance technique does is, it the ahata, anahata sounds, heard sound, unheard sounds, it synchronizes within the body. For example, a, u, ma, and om. So this is chanted loud. That is heard, chanting. Then the same chanting is done without creating sound internally. That is unheard, anahata. So when you do this ahata, anahata, then what happens? That vibration, what is created, balances the entire forces within your body, and you get healing effect. So that is one we have tried on neck pain and back pain, and it has been hugely successful. And everything is, proved by research. There is nothing like hi-fi saying this yoga helps, that helps. That there has no scientific basis. We have got publications done, and the publication has now been accepted by the highest bodies. So now, as a doctor, as an orthopedic surgeon, I used to work closely with the patients, and then realized what was lacking. There was some X factor that was lacking in the treatment, and I found that X factor was yoga. And I used yoga in a sense that it completes the treatment. It doesn't compete with the treatment. It completes the treatment. So there is no question of some competition going on. Yoga is better, modern science is better, nothing like that. Yoga is 5,000 years old. Modern medicine is 200 years old or 250 years old. So there is no comparison between the two. But how you amalgamate it, how you integrate it is the one which is going to be extremely important. So me doing it is not very great, but Vinay doing it is really great. Why? Because he is not a medical background, professional. He comes from an engineering background, that to IIT. So how many people get into IIT? I don't know. Microscopic. Only that many, intellectuals. His Vijnanamaya Kosha is highly developed. He is an intellectual person. He has done MTech. And then coming to the medicine, like back pain and neck pain, is truly remarkable. So his is a journey, I think, a personal journey. I think no orthopedic surgeon could rid him of his back pain. So he was drawn towards yoga. So that is the failure of we people. But we failed, but we gave one author to all. Now, your work will relate to all of them better. Why? Because you are mostly you're like them, in the sense that you don't have a medical background. So you, out of your experience, you have written a book. So that may resonate well with the audience or with the readers, because they may feel he's a guy like us. If I write a book, they feel he's an orthopedic surgeon, he knows. So what? He might have written. But when you write, then what happens? That too on medical subjects like back pain and neck pain, it definitely has got a deeper impact. So I should compliment you for that. I also, I'm going to read that book, find out what I don't know. Really, see, I don't know. There may be some, things. Knowledge is like an ocean. Whatever we are, whatever highly educated we are, we have not scraped even 1% of the knowledge what is available. So we learn from everybody. So I'm definitely interested to read, to understand, to see your perspective, through which angle you are looking at back pain, neck pain. And everybody knows, all are educated here, all are tech savvy. They know how to get the information. Actually, we are having over information now. It's like a diarrhea of information. So we don't know what is right, what is wrong. You just have to Google, there are millions of pages open. So in that context, this book becomes very important because it is written by a person who has gone through back pain. Then he may be able to influence you all to understand why back pain happens and how we should overcome it. Ultimately, I think your goal is to educate the people, empower them, right? Or make money. No. But writing book is not for making money. We can never make money by writing books. Everybody asks for a complimentary copy. The moment you say I've written a book, sir, nam complimentary copy yavag kodtira? They don't want to spend on book. I don't know what is this mindset all about. ನಾವು ಥೌಸಂಡ್ಸ್ ಆಫ್ ರುಪೀಸ್ ಸ್ಪೆಂಡ್ ಮಾಡ್ತೀವಿ, ಮಾಲ್ಗಳಿಗೆ ಹೋಗ್ತೀವಿ, ಈ ಒಂದು ಮಸಾಲೆ ದೋಸೆ ಒಂದು ಕಾಫಿ ತೊಗೊಂಡ್ರು ₹500 ಹಾಕಿ ಬಿಡ್ತೀವಿ. ಒಂದು ₹500 ಕೊಟ್ಟು ಬುಕ್ ತಗೋ ಅಂದ್ರೆ ದೇ ಆರ್ ನಾಟ್ ರೆಡಿ. People are not ready. This is my experience, not just one experience. I've written 224 books. So I know no, how people's mentalities. They don't want, they will just, what we get is some fame we get by writing book and people envy us. Book ಬರೆದನಪ್ಪ ಏನು, book ಬರೆದನ ಅಷ್ಟೇ. ಅದು ಬಿಟ್ರೆ ದುಡ್ಡಂತೂ ಸಿಗಲ್ಲ ನಮಗೆ. ದುಡ್ಡು ಸಿಗಬೇಕು ಅಂತಂದ್ರೆ ನಾವು ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಬೇಕು. ನೀವು ನಿಮ್ಮ ಇಂಟೆಲ್ ಕಂಪನಿಯೋ ಯಾವ ಕಂಪನಿಯಲ್ಲಿ ಇದ್ರಲ್ಲ ಅಥವಾ ಅಲ್ಲಿ ದುಡ್ಡು ಮಾಡಬೇಕು. ಸೊ ಬುಕ್, ಐ ಅರ್ಜ್ ಎವ್ರಿಬಡಿ ಹಿಯರ್, ಡೋಂಟ್ ಆಸ್ಕ್ ಫಾರ್ ಕಾಂಪ್ಲಿಮೆಂಟರಿ ಕಾಪೀಸ್. Pay him 500 rupees, take the book. He deserves it. He has spent his midnight oil and so much of labor has gone into it. ಈಗ ಮನೆಗೆ ಬಂದು ಕಸ ಹೊಡ್ಕೊಟ್ಟು ಕೆಲಸ ಮಾಡಿ ತೊಳೆದ್ರೆ ದುಡ್ಡು ಕೊಡ್ತೀವಿ, ಹೌದಾ? ಕೊಡ್ತೀವಲ್ಲ ಮೇಡಮ್? ಪ್ಲಂಬರ್ ಬಂದ, ಎಲೆಕ್ಟ್ರಿಷಿಯನ್ ಬಂದ, ದುಡ್ಡು ಕೊಡ್ತೀವಿ. ಅದೇ ಬುಕ್ ಬರ್ದವ್ರಿಗೆ ಫ್ರೀ ಕೊಡಪ್ಪ ಬುಕ್. It is like saying those plumbers and this housekeeping job ಕೆಲಸ ಮಾಡಿದ್ಮೇಲೆ ಫ್ರೀ ಆಗಿ ಮಾಡಿ ಹೋಗಪ್ಪ ಅಂದಂಗೆ ನಮ್ಮನ್ನ ಬೈದ್ಬಿಟ್ಟು ಹೋಗ್ತಾರೋ, ಇನ್ನೊಂದ್ಸಲ ಕರಿಬೇಡ ನಮ್ಮನ್ನ ಅಂತಾರೆ. ಸೊ ದಟ್ ಈಸ್ ಹೌ ನಮ್ದು ಲೇಬರ್ ಏನು ಅಂದ್ರೆ, ನೀವು ಅದು ಬೈ ಮಾಡಿದ್ರೆ ಅವ್ರಿಗೆ ಲೇಬರ್ ಕೊಟ್ಟಂಗೆ. ಸೊ ಪ್ಲೀಸ್ ಬೈ ದ ಬುಕ್. ನಾಟ್ ಓನ್ಲಿ ಬೈ ದ ಬುಕ್, ಪ್ರೊಪಗೇಟ್ ದ ಬುಕ್. You have to tell others. This is what to say. We are living in a world where marketing is the tool. And I am extremely bad in marketing because I'm a doctor. I don't understand that marketing head and tail. So many people tell the reels ಮಾಡ್ರಿ, ಯೂಟ್ಯೂಬ್ ಮಾಡ್ರಿ, ಹಾಕ್ರಿ. ಅದನ್ನ ಹೆಂಗ್ ಮಾಡ್ತಾರೋ ಗೊತ್ತಿಲ್ಲ. ಸರ್ಜರಿ ಮಾಡಿದ್ರೆ ಮಾಡ್ಬಿಡ್ತೀನಿ, ಬುಕ್ ಬರೆಯೋದ್ರೆ ಬರೀತೀನಿ. ಬಟ್ ಇದು ಮಾರ್ಕೆಟಿಂಗ್ ಮಾಡು ಅಂದ್ರೆ ಇಟ್ ಇಸ್ ಲೈಕ್ ಎ ರಾಕೆಟ್ ಸೈನ್ಸ್ ಫಾರ್ ಮೀ. ಹೆಂಗ್ ಮಾಡ್ಬೇಕು ಮಾರ್ಕೆಟಿಂಗ್, ಇವ್ರು ಎಲ್ಲ ಹೆಂಗ್ ಮಾಡ್ತಾರೆ? I am astounded actually. Just a 10th pass or 12th pass ಇರ್ತಾರೆ, they are into marketing. ಏನ್ ರೀಲ್ಸ್ ಮಾಡ್ತಾರೆ, ನಿಂತಲೇ ಮಾಡ್ತಾರೆ. I am surprised how this brain works. At least my brain is not working in this direction. So marketing ನೀವು ಮಾಡಿಸಿ, ನೀವು ನಿಮ್ಮ ಫ್ರೆಂಡ್ಸ್ ಹೇಳ್ರಿ ಬೈ ಮಾಡು ಅಂತ, ನಿಮ್ಮ ರಿಲೇಟಿವ್ಸ್ ಹೇಳಿ ಒಂದು 10 ಬುಕ್ ಪರ್ಚೇಸ್ ಮಾಡಿ ಒಂದು ₹5,000 ಆಗುತ್ತೆ, ಎಲ್ಲರೂ ಫ್ರೀ ಆಗಿ ಡೊನೇಟ್ ಮಾಡಿ, ನೀವು ಕೊಡಿ ಫ್ರೀ ಆಗಿ. ಮದುವೆಗಳಿಗೆ ಹೋಗ್ತಿರಲ್ಲ, ಮದುವೆಗೆ ಹೋದಾಗ ಡೋಂಟ್ ಟೇಕ್ ಆಲ್ ದೋಸ್ ಅನ್ನೆಸೆಸರಿ ಸ್ಟಫ್ which will not be utilized. It will be thrown into the basket. ನಾವು ತಗೊಂಡು ಹೋಗ್ತೀವಿ, ಕುಕ್ಕರು ಅದು ಇದು ಎಲ್ಲ, ಅದೆಲ್ಲ ಬೇಕಾದಷ್ಟು ಇರುತ್ತೆ ಮನೆಯಲ್ಲಿ, ಯಾವನಿಗೂ ಬೇಕಾಗಿರಲ್ಲ. ಅದಕ್ಕೆ ಕೆಲವರು ಪ್ರಿಂಟ್ ಮಾಡಿರ್ತಾರೆ ನೋಡಿದ್ರೆ ಕಾರ್ಡ್ ಮೇಲೆ, ದಯವಿಟ್ಟು ಗಿಫ್ಟ್ ಗಳು ತರಬೇಡ್ರಿ. ಸೊ ಅಂತ ಟೈಮಲ್ಲಿ ಗಿವ್ ದ ಬುಕ್ಸ್. It may change somebody's life. Encourage him to write more. Now let him come on knee pain, or let him compete with me in writing all orthopedic subject related books. So my urge to you all is, please buy his book, and not only buy, tell others to read, and you buy in excess and give it to your friends as gifts. So that is the service what you can do to him. Not just come here, receive all his hospitality, eat well, and then just say ಮುಖಸ್ತುತಿ ಮಾಡ್ಬಿಟ್ಟು ಭಾರಿ ಒಳ್ಳೆ ಕೆಲಸ ಮಾಡಿದ್ಯಪ್ಪ, ನಿಂಗೆ ದೇವರ ಆಶೀರ್ವಾದ ಮಾಡ್ಲಿ, ನೀನು ಒಳ್ಳೇದಾಗ್ಲಿ, ನಿನ್ ಬುಕ್ ಸಕ್ಸಸ್ ಆಗ್ಬಿಡ್ಲಿ, ಹರಿಸ್ಬಿಟ್ಟು ನೋಡಪ್ಪ ಬ್ಲೆಸ್ಸಿಂಗ್ ಕೊಟ್ವಿ ಹೋಗ್ತಾ. ಬ್ಲೆಸ್ಸಿಂಗ್ ಅಲ್ಲ, ದುಡ್ಡು ಕೊಡಿ, ದುಡ್ಡು ಕೊಡಿ ಅವ್ರಿಗೆ. ಸೊ congratulations, Vinay. Hope this becomes the bestseller, and you write many more books, and you illuminate, you empower the people with knowledge. And I think ultimately that is real service. That is the one which will stay with you forever, right? All the best. Thank you.
Experiential speaker.
Thank you
very much.
Thank you so much, sir, for that wonderful speech. It's such humble thoughts from a man who's achieved so much. And I'm sure we all agree that we have to support Vinay in this endeavor. And we promise that we will buy books, not just eat his shawagi and shira there. Yes. We are also privileged to have with us Dr. Lata Satish, a distinguished psychologist, researcher, and teacher who has dedicated her life to understanding the deeper dimensions of the human mind. With a strong academic foundation from Bangalore University and the University of Madras, her doctoral work explored the role of yoga in managing blood pressure and stress, bringing together psychology and yogic wisdom at a time when such integration was still emerging. She has had over 25 years of teaching experience, guiding postgraduate and PhD students, and has been actively involved in research through several government funded projects. Her association with Krishnamacharya Yoga Mandiram has been especially significant, where she has contributed both as a senior consultant therapist and as a guiding force in research and teaching as head of KYM Research Council. She has published 55 articles in scientific journals and 2 books, as well as contributed a chapter in yoga therapy book. She has published numerous research articles, authored books, and contributed to important works in the field of yoga therapy, continuing to bridge the worlds of psychology, research, and practice. What makes her work particularly meaningful is her ability to bring together scientific understanding and experiential wisdom, something that resonates deeply with the theme of today's book. It is truly a privilege to have ma'am here with us this evening. May I now request Dr. Lata Satish to kindly address the gathering and share your thoughts.
Certainly. ನಿಂತ್ಕೊಂಡ್ಬಿಡ್ತೀನಿ ನಮಸ್ಕಾರ ಶ್ರೀ ಗುರುಭ್ಯೋ ನಮಃ. ಡಾಕ್ಟರ್ ಮಾತಾಡಿದ್ಮೇಲೆ ಇವ್ರಿಗೆ ನಾನು ಆಶೀರ್ವಾದ ಮಾಡಿದ್ರೆ ಸಾಕು ಅಷ್ಟೇ. ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ರು. I will talk in English as well as in Kannada a little bit. Basically, I come from an institute which is primarily therapy oriented. The first foremost condition where people come to seeking relief from yoga is pain. Skeletal-muscular pain, orthopedic related, various pain conditions. Not only pain in the body, their mind is also suffering. So we handle people giving yoga tools support from all perspectives, not only from asana, pranayama, various tools are given as a support. The person who teaches yoga also becomes a major ingredient in the therapy. Unlike other type of therapy, yoga, where the person who delivers the yoga practices can bring a certain change in the psychophysiological status of the person. That is where, yoga as a perspective adds value to the therapy process. So here in this place, when I'm standing to share with Vinay about his knowledge that he's bringing in this book about how to handle neck pain, back pain from yoga perspective, I can easily resonate with him how much effort he would have put in understanding what causes pain, how to understand that pain from the yoga perspective, different layers of it, from the body, mind, spiritual, different levels, and how to integrate certain practices so that the person is comfortable, well off. This is where. And what doctor said as the research evidence is a mirror. It is a mirror to what yoga can do to the people who are having pain. So in this moment, I feel extremely happy that this book is something like a timely, relevant, essential, very, very essential guideline for people who want to understand how yoga perceives pain, handles pain, gives relief from pain. So that part of it can be useful not only for yoga teachers, yoga therapists, or for researchers, even common people who are day to day experiencing pain or not experiencing pain have to go through this knowledge. Now, one thing, when you read a book, you get a deeper insight into what is that condition is. But go to the teacher, go to the therapist to learn the techniques properly so that person can come out of the issues, whatever issues they're going. So on this occasion, I will add on to what he says. Not only buy the book, read the book, understand it, reflect, and take the help of the teachers, experienced teachers, to come out of the pain. And if you're buying it for somebody, if you're giving it to somebody, advise them that they have to take a very guided, cautious approach in using these techniques. And I think he would not have given a set of postures to be done for this neck pain or nothing. It is not the idea. The idea is the way anatomy, physiology that has been studied in the modern medicine is different from the anatomy, physiology of yoga. So that is where I think his contribution in this book becomes very, very relevant for everybody. So I take this opportunity to congratulate Vinay Siddaiah for his effort in bringing out this book. Really, really, congratulations. Let Goddess Saraswati live in his hand, brain, everywhere, and help him to create more and more knowledge like this so that it will be of value to everybody. And I wish him all the success. Writing a book will put everything in print. He can do a lot of re-edition, revision, additions, many things he can do, and many, many more things as he suggested. And as a elderly person in this field, I bless you.
Thank you.
God bless you. Good. So thank you very much. Shri Gurubhyo.
Excuse me. What's up? We were also honored to have with us Dr. Vidyadhara as Chairman and HOD of the Department of Spine Surgery, Manipal Hospital, one of India's leading spine surgeons known for his extensive work in complex spinal care and surgery. Due to a last-minute commitment, he is unable to join us today in person, but has very kindly sent a message for this occasion. Let us now take a moment to listen to his message.
Greetings from Manipal Comprehensive Spine Care Center, Manipal Hospital, Old Airport Road, Bangalore. I am Dr. Vidyadhara S, Chairman and HOD of Department of Spine Surgery. I am very happy to know that today Yogācārya Vinay has written a book on understanding of back and neck pain, perspective with respect to yoga. I am a strong proponent of yoga because I believe that most of the back and neck pain is related to stiffness of the back, because from the neck to the low back we have 33 bones connected with 2 facet joints and an intervertebral disc, which gives the mobility and the stability to the neck and back. These joints are nothing but bearings, which need full range of movement for them to be completely lubricated and be rust free. And one of the best ways to move all these joints of the neck and back is yoga. Think of one Surya Namaskar. It moves your neck, back, hands, shoulder, elbow, wrist, hip, knee, ankle. Every single joint of the body moves full range of movement. and that is what is required for these joints. Imagine how many times you will move your neck, how many times you will bend forwards, bend backwards, and lift weights. We don't do it very often, and that's why these bearings or the joints get frozen, they get rusted, and then you will get cut sound when you move. And that is where these joints get injured or you get neck and back pain. That is one aspect of it, the physical component of pain. There is also additional psychological component of back pain, which is because of day-to-day stresses that we incur in our lives. And this yoga is a big way to tackle the psychological component of your back pain and neck pain by way of knowing the right way of doing the breathing exercises. And one Surya Namaskar done with good breathing pattern, I think will help you tackle both arms of pain, whether it is back or neck pain, because it tackles both physical and psychological component of back pain. I am sure the readers of this book will be greatly benefited by the concept that Yogācārya ji is describing in detail, and I am sure this is going to be a landmark book in the years to come. Thank you for inviting me for this. Unfortunately, I am not able to be there physically, but I hope it will be a grand success. Thank you.
Thank you, sir. Thank you, ma'am, for all the blessings and the words. We have heard different perspectives on pain from medicine, from psychology, but beyond understanding what truly matters is experience. Over the years at Yogavijnana, many individuals have come with pain, confusion, and limitations, and have gradually discovered a different relationship with their body. Let us now take a moment to hear from few such experiences. I invite Dr. Mahesh Arvind to come forward and share his experience with back pain and how yoga has helped.
Namaste. Very good evening to all. I'm Dr. Arvind, Professor Emeritus, and also Chairman of Pragya Foundation. I'm here in Yogavijnana practicing yoga since 2 years from 2024 June. I joined here, though I was not new to yoga practice. Since 2001, I am into yoga practice. But in 2011, I met with an accident where I developed a disc prolapse problem. So I couldn't even bend a little at that time. And later, through yoga practice itself, I came to normal. I was very much normal. While doing exercise, I always remember Padahastasana, I used to go 100% perfect, but I'm unable to do it now. I cannot take risks, restricted. But later in 2022, though since then I was normal to 2022, in 2022, I developed the sciatica problem, that the disc prolapse problem that has radiated, that I was told so, has radiated into that issue. And when I went to doctors, I was told to go for the neurosurgeons, advised to go for neurosurgery. As doctor said, I also went for second opinion, third opinion, and all. And later I learned, when I observed many the post-surgery issues, there were severe problems. I could I studied few cases also from doctor's side itself. So I learned that it's risky to go for a neurosurgery. So I myself postponed it, and fortunately I got a physiotherapist. He is friend of Vinay Siddaiah, Dr. Gladson. So he, over 10 to 11 months, through regular exercises, he brought me to normal. And he advised me to go for Yogavijnana. So from that advice, I was prescribed, so I joined Yogavijnana. After joining here, I could understand yoga in a different perspective. Though I was into it since many years, but I had not learned in that way. But yoga here, Yogavijnana and Vinay Siddaiah made me to understand with the scientific approach. My problem is not only yoga as a whole, with respect, my problem, it's my issue itself, I could understand scientifically what it is and so on, why it is and how to come out of it. And through his guidance, one thing I like to share, he made me to understand that yoga itself is a science, that itself is a science, and not asanas, it's pranayama. Here I joined the two levels of pranayama courses, level 1 and level 2. There I could understand it's not a physical issue, my own issue itself, problem itself. It's not a physical thing, physical problem. There is a mental, it can be considered as an issue depending upon the mindset also. Because I could understand, not only understand, I could feel that even my mindset could aggravate the problem as such. Not only aggravate, the mindset itself can be a remedy, can bring down the problem also. So that I could understand from Vinay's side. So really, now I'm quite normal from his guidance. So I could not stand in this posture also. Many have seen it, and they say that you are perfect now. And even after my retirement, I'm so active, and that's because of all his therapeutic way of educating me and giving me an understanding approach and so on. So that's up to you
Okay, sir. Thank you.
for your knowledge. And it's not exaggeration. Even though it's not the issue is not relevant to the theme of the topic. I had otherwise mental issues also due to personal issues. I had developed that problem, and even I could get a solution on my own through his guidance. And thank you so much, sir.
Thank you,
Thank
sir.
you so much. Thank you for giving me an opportunity to share.
Thank you, sir.
Thank you, sir, for that sharing. May I now invite Dr. Veena to come forward and share your experience on how yoga has helped your journey and has also led to the point where you have now become a certified yoga teacher at Yogavijnana.
Good evening, everybody. I'm Dr. Veena. I'm basically a pathologist and I practice at HCG Cancer Hospital.
She hates the
My work basically
She
involves
hates the pathology, but
sitting
it is-
for long periods of the day and then looking into a microscope or working on the computer. So I used to develop back pain and I was not, I mean, it's not that I was not aware of yoga, I mean, the word yoga. So I used to buy books on yoga and I used to practice on my own, but it all used to be like intermittent practice it for 2 months and just see, which it was not a very serious practice. I was not too serious into it and I just used to suffer with back pain. Uh, COVID actually gave me that opportunity to seriously look into my issue of back pain, and that is when I started exploring uh, yoga schools in and around, as I wanted to learn from a good teacher or a very good instructor. That is when I came across Yogavijnana and Vinay sir, and I attended his fundamental workshop. And this workshop actually was a sort of eye opener for me, that I understood that yoga is not just what you perceive as asanas. It is something beyond that. And it was very clear from his fundamental workshop that there is so much of aspects that yoga covers in your body, that it's not just physical, it is something beyond your physical perspective, which can also have an influence on your entire the body, the mind, whatever thing. So after I attended the fundamental workshop, I realized that I need to learn from him, because I felt he was the best teacher that I had come across. And I joined the yoga classes. And within a month, his meticulous way of teaching, his systematic approach to the problems that you have actually started helping me, addressing my back pain, and then my back pain actually disappeared. And since then, I think I wanted to learn more from my own perspective and my own understanding. And he actually understands the students better. Before you realize what you want to do, actually he knows what you need. And he pushed me to take up the teacher's training course, and under his able guidance, I did complete my yoga teacher's training course. This gave me a much more understanding of yoga as a science. Like how we study our medicine, yoga is also a type of science. And so I have been practicing for the last 5 years under Vinay sir's guidance. And this book actually, though we have heard from him during the classes, a bit of it addressing these issues, but I think the whole concept has been brought out in a much more easier and a simpler understanding way. And he's a very good teacher. We all know that, and all my sincere thanks to him for being my teacher and helping me address my own health issues apart from the back pain, even addressing the stresses that we undergo as doctors in our day-to-day practice. So the 5 years of my association with Yogavijnana and Vinay sirs has been very good. So it has helped me address all my challenges, not only the physical, the mental, and even whatever the spiritual things that I have started exploring. So a very big thank you, sir, for all the hand holding me and taking me in this journey of yoga.
Thank you, Dr. Veena. Each of their journeys have been different, but they all point to one thing, that when understanding changes, the experience of pain also begins to change. So we now come to the person whose journey brought all of this together. Please join me in welcoming author Yogācārya Vinay Siddaiah to share his views on the book.
Thank you. Thank you so much for, first of all, for all of you for coming here, and thank you for both of you for such encouraging, motivational words. Let me start by answering your question. So our alma mater is same Yasvyasa. So I have through Guruji's contact, and I think you know Subbu Bhaiya. So Subbuji is a very good friend of me. I think he's from he's the secretary of the state chapter. And I was just brainstorming this because I'm also part of the state chapter committee, and I was just brainstorming. So I just wanted this book to be released by a medical doctor who also understands yoga. So I was asking who is the better. We were brainstormed a few names, and then finally we just thought I think he is the best person to go to, because he is having that strong medical background and also yoga background. I think no better person than you to launch this book. Thank you so much for. Okay. All right. So coming to the launch itself, I'll just go through the slides here. So this is the book that we have launched. Thank you. All right, so how many of you have experienced pain here? So how many of you have some back pain, neck pain? It's a universal problem, right? Yeah. See, when I was a small child, the problem was malaria, tuberculosis, and all of those extra things. And then when I was doing my MSc in yoga, then it was psychosomatic disorders. So now this has become common. And reason could be psychosomatic also here, but this is so common that almost like 1 in 5 people will definitely experience back pain at one point of time. Okay. So then, so even it happened to me also. Around 19 years back, I was suffering with back pain. And that is what actually, when I went to the mountains, I was into a trekking, as I think most of you know. So when I was trekking in the Himalayas, I was suffering from back pain. And that is when my mountaineering teacher is the one who told me to go and do yoga. That was 19 years back when I just came to yoga because of that guidance. And that's why Even to this day, I consider mountains as my spiritual guru. So, and then what usually we hear about back pain is it is a disc bulge is there, some wear and tear is happening, some postural problems. Because of all of these things is why we get the back pain. That's a common thing. I think somebody already shared how the disc prolapse, even then we could come out of it. Okay, but although some of times we have glorified it a lot. So and that is exactly what I was seeing, not just in my experience also, but even looking at the people who come to me for therapy. Because whenever I come see people coming to me for therapy, they come with these prescriptions only. Somebody said posture is not proper. Somebody said disc is a problem. Somebody said wear and tear is the issue. Okay, and this is what the common usual explanation which I've heard from a lot of people who come to me. And then when I started thinking about it, these are the two questions which bothered. One is there was a pain sometimes without damage. Some of us have experienced. I've got people who come to me saying that I have pain, but MRI reports look normal. It's quite common. MRI reports are normal, everything is normal, but still I have pain. How do we answer that? Okay. Or damage is there, but there's no pain. Once upon a time, when they take an MRI, they'll get to know. Whenever they go to annual medical health checkup or something like that, they get to know that something is there, but the person is not experiencing anything. No pain at all. So these are the contrasts that we have seen, and trying to understand this contrast is what led me to this 19 years of journey, I would say. Okay. And then the core insight is what I realized is pain is not equal to damage. A lot of times we think pain is equal to damage. Whenever somebody has a pain, it is a damage thing. Something has gone wrong. And these two are not equal. Okay. And then when we start rethinking the body itself, right? We just need to understand that the body can adapt, body can protect, it can learn, and it is a living system. So why I'm saying this is, a lot of us, whenever we think about these pains like back pain, neck pain, we think it is stamped on us for the rest of our life. When we get a back pain or neck pain, what we usually think? Oh, then back pain, lifelong back pain only. That's what we usually think, right? We just think that it is stamped for the rest of our life. It is in fact not so. Because when somebody can give you pain, it has the capability to adapt and change and become pain-free also, provided we work towards this. But what stops us from working towards that is fear. Because pain is something which is scary for most of us, right? Moment we think of pain, it scares us. When I say do some exercises, you say, oh, I get pain. What if the pain increases? Because without movement, I'll tell you, no pain can subside. The movement is the only, because we're all born to move, right? We cannot be sitting idle doing nothing. We are human beings, we have to move. And the movement is the only thing which can fix something also. So that is exactly what I started discovering for myself, where we just have to learn, it can adapt itself and it can change. Okay. And looking at the nervous system as well. So pain, if you look at it, right, it is not something dangerous. It is a response from the body to say it's trying to indicate something to us. When you get a pain, it is a way of body telling us you have to take care of something. That's exactly what the language is. But what we do, we forget the language, we get scared. We forget to understand the language also, we get scared. And that is exactly what I have covered in detail in this book also. And if you look at the patterns of the pain, right, the pain doesn't happen suddenly. It doesn't come all of a sudden. We just start getting indications from the body. But problem is, our awareness is not there to understand those indications. Suddenly, if somebody says, I was lifting a bucket, I got to catch at the back. But that doesn't happen at that moment. Over a period of time, the body was giving you that indication. Something is not right. Try to fix it. But because we try to ignore that, suddenly one fine day we get into that. Okay. And by sitting or repetitive movements of wrong movements or stress, as somebody rightly mentioned, is also one of the cause of pain nowadays. Okay. And lifestyle. So understand pain is just accumulation of all of these things together. It is just not one incident that got us there. And many times we blame that incident. Bucket at put lifelong, I'll not lift the bucket. That's what we do, right? Or if you just take something from the shelf, got the back pain or neck pain, I will never do that activity for the rest of our life. That's not the way our approach should be. Our approach should be to train ourselves, to recover ourselves, to do the same activity without pain. That should be our goal. And it is possible because body can learn, body can understand that. Okay? Provided you want it. So the key shift we have to do is you try to trying to fix pain, try to understand these patterns of pain. Because it's a language that is trying to say, if you focus on that language, then you can fix it faster. What we do, we just say pain, pain, pain. That's the only thing we say. Not try to see why that pain is coming from. What is happening with that? Okay. And then the treatment illusion is sometimes, most of the times when we go for treatment, I've just dedicated one complete unit on treatment illusion. We just think surgery is I think the solution for everything because it's easier to do. But if you do want to fix it without surgery, then there's a lot of effort required. Regularity is required, consistency is required, practice is required. That's why the shortcut looks surgery. But there is a lot of things which I have actually documented, and whatever I have taken and I explained here, I've just in this book, right? There are 10 pages at the end. It's only a bibliography of 64 research papers which I have referred to write this book. Okay, so all the research papers have kind of documented there also, so that people who are reading that will understand that it is just I'm not talking something from hocus pocus kind of. There is a research evidence based on whatever I'm saying in the book also. Okay, and the turning point is that is exactly how I found yoga, because yoga is just not exercises. It's something that regulates us, it educates us, and it restores us back to its balance. And not just from physical perspective itself, it works at multiple dimensions. I think that is something which we have explained in detail in the book, in what all dimension the yoga can work. Okay. And then from threat to safety, and understand this, not to heal yourself, right? First of all, the key thing which helps us to function is our breath. And most of the times we ignore breathing. Okay. If you happen to focus on a breath, your breath can tell you what is going on within you, physically also. Okay. Looking at the patterns of your breath, you can understand what's going on within us. You can probably, if you start focusing on your breath more, right, you'll understand all these things. And awareness, nowadays, most of us, we are so busy with our day-to-day activities, we are not aware of what's going on within us. Provided if you start observing what's going on, naturally it can change. And then slow movement. Slow movement, why? Because we are all used to fast-paced movements, high-intensity activities. That's what is a common word nowadays, right? We all want pace, but nobody wants to slow down things. And the issue is happening because of the pace. But moment to slow down and witness what's going on, then a lot of things will start revealing to us. Okay. And then the idea is the body can learn new pattern, it can reduce fear, and it can help to create better movements in us. And it's all at the end of the day, even if you don't believe in yoga also, it's just a movement science that we are talking about. You all move, we all move. So it's just about movement science. That's it. Pure movement science. Okay. But of course, without yoga, you cannot understand complete movement science also, because it's incomplete without understanding yoga, yogic aspect in that. Okay. And the core message is healing is not fixing a part, it is restoring the balance in the whole system. And that is exactly what we have explained more detail in the book. So just to explain what this book is about, it just explains why the pain happens, why it persists, and what actually helps. And it's not about changing, it's not about giving a quick fix solution itself, but it is about changing your perspective to look at the pain itself. Because once you change your thought process, because a lot of us nowadays, we are in the scientific mindset people, right? We want logic for everything. When we go to a doctor also, we want logic of going for surgery, logic for not going for surgery. Everything with logic. If doctor doesn't give logic, what will you do? Chat GPT and Google. Right? And Chat GPT Google is written by somebody only, and it just pulls out some algorithm and it just pushes it to. I think I was talking to doctor in this clinic sometime back, and he was telling this beautifully. Even to understand what ChatGPT says, it should be an experienced person to understand what it is saying, to make sense out of it. Because if a layman goes and refers to ChatGPT, he just believes whatever the ChatGPT is saying. But if we go look at ChatGPT, we understand where this is coming from, and we can at least make sense out of it. So just don't believe blindly all these Google and ChatGPT, because it just gives you some pointers only, but not everything. Okay. So that is exactly, this book is an attempt to change that perspective in all of us, how we look at the pain patterns itself. Okay. And then not to just say this book is divided into 6 different, I'm just showing it all because I just don't want to bend every now and then. Okay. All right. Book is in 6 units. The first unit talks about rethinking the pain itself, moving beyond the obvious, where I just explained some facts about the pain, all of these things. And then understanding body as a living system, how everything is connected and everything is working together. I explained a little bit about biomechanics. But of course, this book is written in a way that every lay person can understand. Even if you don't have any medical background, if you open that book and start reading it, you'll appreciate the whole concept. That's how this book is written, and how pain patterns are created. If you're getting pain, what are the lifestyle things that you're doing? Even as simple as what kind of footwear you're using, or how that footwear is being used. All of that is going to influence our pain. All of that is explained here. And treatment illusion. So why surgery, painkillers, and muscle relaxant, how that has its own limitation, because that's all okay, acute conditions. But if you start getting addicted to these painkillers and muscle relaxant, right, what essentially you're doing is you're cutting down the response of pain itself completely. Okay, so instead of understanding pain, you're just shutting the pain. It's of no use. So that is something which explains in detail. And then finally, recognizing the path towards recovery. So how do we come out of it? What are the signs to know that you can recover from the pain? And when you start recovering, when you start working on it, how that working cannot be linear. A lot of times people expect everything to be linear. If I'm reducing the pain, everything should systematically reduce. No, it doesn't happen that way. Suddenly one fine day it can shoot up again. That's not a problem. That's a way of body learning itself. That's all. But we stop doing after that. Oh, yoga ಮಾಡಕ್ ಶುರು ಮಾಡಿದೆ, pain ಜಾಸ್ತಿ ಆಯಿತು, stop everything. That's not the way it is. Okay. So I've just explained how these pain patterns, how can you recognize the path towards recovery? And finally, how yoga can support in all of these as an intelligent support system itself. How yoga can help in our healing. Okay. And in this also we have explained from different perspective, from Panchakosha perspective, from Ashtanga perspective, and all of these things. Again, just to make you understand that there is something beyond physical body itself towards pain, not just the body itself, beyond body dimensions. That's exactly what we have covered in this. Of course, the book is already available in Amazon in website. I think in a couple of days it will be available in Flipkart. Notion Press, who is the publisher of this book, it's already there in their website. And by the 10th of May, this book will be available worldwide in all the Amazon stores. So you can just share over in another country also to pick up the book from their own countries and start reading from there. Okay, they don't have to ask you to send a copy. They can just get it within a week's time. It will be available everywhere. Okay. And then understand this book is not about fixing pain, but rather it's about understanding. Something is making sound. All right. So this book is not about fixing pain, but it's about understanding it is. That's exactly how this book helps. Because if you understand, you can work towards it better. Okay. And of course, when I did this book and I spoke about this book to a few people, somebody asked me, why don't you start something to teach me how to recover from that? All of this theory is fine, but teach me something practical way. And that's where we are planning to start this course also, to how to fix this posture sometime in June or July. Whenever this happens, we will let you know. In case if you are interested in this course, you can just express your interest. We are still not planned anything, but of course I can teach, because I've been teaching therapy from past some years now, maybe more than a decade now. We can do something there. So this course is not going to be about asanas. It's not about mechanical exercises. It's about how to transform your awareness through movement patterns using yogic insights. You're going to use yogic insights, create some movement patterns to fix your pain. That's all it is. Okay. The movement patterns can be anything. So this is the QR code. I think it's in the near the backstage also. So you can just scan the QR code if you're interested. You can express your interest, and then we can look at it later. Of course, this journey has not been a solo journey. If somebody thinks I have done everything, no, definitely not. Okay, I'm just being an instrument in this whole journey, and a lot of people have contributed to this journey. So just want to acknowledge them in this whole journey itself. First of all, the turning point came from the mountains itself, which I consider as my spiritual guru. In fact, I had to release this book before I go to Kailash. This month, we are going to Kailash Yatra. So I just want to take a copy to the mountains, because the journey started there. And every time I go there, there is some insights which I'm going to get from the mountains. Okay. So I just want to definitely thank. And of course, all my teachers who have given the early guidance, Sanjay Gurvekar, Karthik Chaitanya, Sharat Arora, Dr. Soru, Dr. S.N. Omkar, Raghavendra Shenoy, Dr. Sri Rangaji, and Dr. Gladson, all of them who has contributed in different phases of my learning in different meaningful ways. So I just thank all of them in this journey. And of course, the foreword, which is written by my Guruji, Dr. H.R. Nagendra. So he's the founder of SVSI. He's also a Padma Shri award winning, and he's also very popularly known as the yoga teacher of Prime Minister Modi itself. Okay. And when I went to ask him for the foreword, and he just said, send me the copy, I look at it. Because I had taken a printouts of the book, and I just thought, how will he have time to even read the book and give forward? But after 2.5 weeks, I was surprised that in my inbox, I got the feedbacks, over 25 feedback, including a suggestion to add a new chapter. Okay. And that's because he is now 82 now. He is a Padma Shri award. He is a guru of for both of us and many more teachers in the field of yoga. See, he doesn't have to. I never thought he'd do this. First of all, because he has spent time to read this book meticulously, given the feedback, said add this chapter and let me know. after adding the chapter, making all the changes, and that is when he actually wrote the forward. Okay, and I of course thank Dr. Ananda Balayogi Bhavnani ji. He's again one of the fantastic teachers in our country, chairman of ICYER, and is from Ananda Ashram, Pondicherry. Again, a beautiful human being. When I approached him saying that I want your forward, he said, send me the copy because he's not in Bangalore. And I sent the book copy. And he's the first yoga therapist in our country to be recognized by the International Association of Yoga Therapists. Okay. So, and he's a medical doctor, by the way. Okay. And he runs a yoga therapy center in his hospital only. Okay. In his hospital in Balaji Vidyapith, he has a separate division of yoga therapy. And that's how kind of a doctor he is. So, and thanks to both of them, and they're also the Yoga Chikitsa Ratna from the Indian Yoga Association, and one more Yoga Chikitsa Ratna is sitting right next to us. So, thank you so much, madam. Thank you. Okay, and they are all the inspiration for all the youngsters like us because their action speaks a lot. Because if you had not spent, if both of them, and even the madam, if she had not come here or something, it's not a motivation for us, right? Because we are all here continuing the legacy of yoga because of their motivation. So I thanks to all the stalwarts here. And of course, the institutions, my yoga institution, SVYASA, my IIT Hyderabad, where I did my Heritage Science and Technology course, the Yoga Institute Bombay, one of the world's first organized yoga institute where I was teaching as well, and Kathmandu University in Nepal, again, where I was teaching, taking the classes for their yoga and well-being department. And of course, I want to thank my past companies also, Intel. I think my manager is there from SanDisk, and I missed my manager from Intel today. So because of their support only, I could continue yoga, I would say. So because I know I was going to office every now and then, so I was not on time to the office whenever I had yoga classes. But he understood me very well. Okay, so he knew that my passion was in the field of yoga. Thanks to Thaninder and all my Intel colleagues are here. Thanks to all of you for supporting me in this journey of discovering yoga for myself itself. Okay, and of course to all of you, so has been the backbone for me, and teaching definitely is been a greatest teacher for me. Okay, so thank you for all your support. The entire Yogavijnana family was always stood with me in all the things ups and downs that I've been going through. And of course, the community of Indian Yoga Association, I think some of us are from Indian Yoga Association. Thank you so much for the support that you are here. It's the biggest association of in yoga in India. So thanks to the association for a lot of support that they have shown in this whole journey. And of course, I want to thank Mansa. Can you just open the books? I just want to thank all the editorial contributors here, Dr. Veena, Akshata, Pratibha, Vijaya, Siddaiah, and Uttam Kumar, who has gone through the book, multiple revisions of the book sometimes. So before the book came to this stage that it is there. So because I was sending them the soft copies, printouts, they had to read the whole book, suggest additions, subtractions, everything. So as a token of gratitude, I want to offer them, each one of them, the book that I have written. Okay. So I just request all those who contributed in the editorial journey to please come forward and collect the copies. I just want to give the first copies to them before anybody take the book. Okay. Okay, Dr. Veena first. So thank you. I'm going to be lucky. Thank you so much. Thank you. I think Akshata is not there. I just probably call Pratibha. Akshata, I just give her later. So she's also the manager of Yogavijnana. So apart from managing, she has to do all of these things also. Thank you so much, Pratibha. Thank you. And my sister, Vijaya Uttam. So she's, again, when you're a sister, right? How somebody like me, all these, something is extra work. They have to read my book, book reviews and all of this. So thank you so much. Thank you. And of course, my brother-in-law, Uttam. And he's from a teaching background and IT background both. So as a teacher, he reviewed my book like he's reviewing an answers book filled from a student. Thank you. And I don't know, Vinuta is there? Vinuta is not there. Okay. I just want to thank Vinuta for the cover design that she has designed for the book itself. I just give the copy to her later. And of course, my family for all the trust, patience, and support they have shown in this entire journey. And I just want to be grateful for the tradition of yoga itself. So because as he was telling, it's a 5,000 years old tradition that we have. And we are just a small contribution. We're just continuing the legacy. That's all. We're not doing anything new. We're not inventing anything new. That tradition is there as it is. If you pass the tradition, that itself is a great thing that we can do for us. Okay. So thanks to the tradition of yoga, and I'll remain a student and I'll keep exploring for sure. So thank you so much for all of you.
As we now move towards the concluding part of this evening, we would like to take a moment to express our gratitude to our esteemed guests. I now invite Yogācārya Vinay Siddaiah to kindly felicitate our respected guests as a token of appreciation and gratitude. May I request him to first felicitate Dr. John Ebnezar.
Yeah.
Sir, this is a small gesture of a deep respect for your contribution and your presence here today.
Thank you so much. Thank you. Thank you so much. And this is a small footy clip that time. Thank you so much, sir. Thank you.
Sir, may I now request you to felicitate Dr. Lata Satish.
Akade bartini bidi alle iridi. Yeah.
Ma'am, our sincere gratitude for your guidance and your presence with us.
Thank you, sir.
Thank you.
Thank you. Thank you. Thank you.
Thank you.
Thank you, madam. Tilla book it ko both dekha hai.
As we come to the close of this evening, the book Understanding Back and Neck Pain, A Yogic Perspective is now available for all of you. You may purchase your copies at the backstage. There is a bench that is kept and you can collect it there. And Yogācārya Vinay Siddaiah will be available to personally sign the books as well. As you move towards the counter, you will also find a set of bookmarks. Each one carries a simple reflection on yoga, and you're welcome to pick one that resonates with you. Perhaps the most important takeaway today is that pain is not always something to fight. Sometimes it is something to understand. And for those of you who wish to take this understanding further, structured course based on the insights from the book will be launched soon, as Vinay just mentioned. And you can scan the QR code displayed at the book sale area to express your interest and receive further details. We invite you to take this understanding forward, not just through reading, but through practice. Thank you for being here and for being a part of this journey. Namaskara.
Thank you, madam. Thank you. ನಾನು ಹೆಲ್ಪ್ ಮಾಡ್ಲಾ?
ಇಲ್ಲ ಪರವಾಗಿಲ್ಲ ನಾನು ನೋಡ್ಕೊಳ್ತೀನಿ
ನಾನು ಹೇಳ್ತೀನಿ.
ಅವ್ರನ್ನ ನೋಡ್ಕೊಳ್ಳಿ
ಬುಕ್ ಇಟ್ಕೊಂಡ್ರಾ? ಓಕೆ.